Every year, about 400 babies are born with hemophilia A, a rare bleeding disorder where their blood can't clot, making even a simple cut life-threatening. But a new approach is showing success. 14-year-old Jalen Smith-Brown always knew that he had to keep his distance from others.
I couldn't run around with all the other kids, play tag or nothing.
Jalen was born with a bleeding disorder called hemophilia A, or factor VIII deficiency. If he got a cut, it could cause severe bleeding.
It felt me like I was stuck in a bubble.
Even worse, his body was attacking the factor VIII infusions that were meant to treat his condition.
Because their body doesn't recognize it, because their body doesn't make it, their bodies can actually attack the medicine that's there to help keep them safe.
So, to treat it,
we give the factor medicine very often, usually every day at very high doses, to try to trick your body into thinking that the medicine should be there.
I mean, that's pretty difficult on a child. They become very emotionally exhausted.
Doctors at Children's Healthcare of Atlanta devised a first-of-its-kind approach called the Atlanta Protocol. By treating patients with a high dose of factor VIII, along with the drug emazizumab, doctors can get rid of the antibodies that fight against factor VIII and prevent patients from bleeding. Jalen was one of the first patients in the world to try this new approach in 2019.
He's one of the first 2 patients in the world to be tolerized using this regimen.
For Jalen, that means he does not have to live his life in a bubble anymore.
It feels like I'm like a regular boy now.
Can Jalen have a hug?
With the Atlanta Protocol, patients only have to do the factor VIII infusion 3 times a week versus every day with the current line of treatment. And it is called the Atlanta Protocol as a nod to the city in which it was developed. And that's your Health Watch. I'm Connie Fellman, Local 5 News.